overweight, your ideal weight should be around the sort of 75 to 80 kilogram mark. And you're 125, so you're about 45 kilogram overweight. You've got about a 60% chance of losing 30 to 35 kilogram in the first year. We generally like about a kilogram a week. If you're walking for 40 minutes a day, you can lose a kilogram a half a week.
Well, I've never been able to lose that sort of weight ever.
No.
Best I've ever lost 10 kilos, I put it straight back.
Well, as I said, we're a support system. There's not just me, the surgeon. We've got a dietitian, got people to do with the exercise. In fact, as also part of the protocol, when I get you to see the physician and the psychiatrist, you then come back and see me again with a list of questions. So I can answer, right, I like you to write them down so you don't forget any. You then, after that happens and we all agree, and you agree that you want to go ahead, and I agree that it would be suitable for you to go ahead, we then get you to see our dietitian, and we put you on a OptiFast, which is a low-calorie diet for about 10 days before the operation, because that really makes the liver much softer. And if you go to do the operation, if a hard liver, it can be more difficult. So once the liver softens up, it's much easier to operate.
And I take this for how long? A week?
About a week. About a week.
Does it taste okay?
It comes in all flavours, from chocolate to vanilla to chocolate bars even. It's actually really quite tasty.
Okay. And is it a meal? Is it a replacement for meals?
It is a replacement meal, although you can have a light meal at night with some salad and things like that.
Okay.
And you're surprised, you'll lose a few kilo on in that situation too.
Okay. That
now,
sounds good.
Yeah, when you're in hospital, the dietitian comes and sees you and they give you a whole screen of what you should be eating for the next 4 weeks. We see you every day in hospital. I see you a week later here in the office, and then a month later, because we don't even adjust the band for a month. I had one patient who went from 180 kilogram to 80 kilogram in a year without a single adjustment.
And if you do the adjustments, do you do them, how often do you do them?
Well, basically, we see you at a month and then probably 2 or 3 times a year for adjustments further on. I've got colleagues here, we're actually a group that have a number of people doing adjustments, and then but you come back and see me intermittently as well.
Okay, okay. And
So,
I'm expected to lose roughly a kilo a
about
week?
a kilogram a week. Again, if you walk for 40 minutes a day, you'll lose it even a little bit more.
Oh, that'd be good. Be very good.
So there we are. Have you got any questions at the moment?
Well, apart from the money aspect, tell me, any other things improve apart from my overall health? What else
Certainly
improves?
your high blood pressure tends to drop. Obviously, confidence. One of the things I've noticed is that when people lose a lot of weight and they're suddenly becoming more confident about going out socially, not being reclusive, all these other aspects of life, that makes their life much better. In fact, one of the things most people say, if I ask them, well, has it changed your life? And the answer is most definitely. And most of them say it's the best thing they've ever done.
I'd like to be able to buy some clothes from a regular shop instead of having to shop at fat places all the time that I don't like doing.
Well, it'll certainly happen once you lose the weight. Now, what we're going to do today is I'm going to weigh you, and then I'm going to have a look at your tummy. Then I'll give you the names of the other doctors to see. If you ring them up and say it's for assessment for banding, you'll get in very quickly.
That'd be very good.
And as soon as you make that appointment, make an appointment to come back and see us with a list of questions.
Okay.
All right?
Thank you very much.
If there's any queries at any time, don't hesitate. Give us a call.
Wonderful. Thank you very much.
All the best.
Bye-bye.
I'm Harry Frydenberg. I'm the director of the Epworth Centre for Bariatric Surgery. And as a surgeon, we